Alright, here we are. This is the cybernatomy video for the lab on superficial face. First thing you're going to need to do is go ahead and remove the bag from the head. You'll notice that the brains have been removed from the cadaver, so that little bit of work has been done for us. You may have sort of a emotional or visceral response to seeing the cadaver's face for the first time. You may not, but please be sensitive to those around you who may or may not be having issues. For our dissection, the first step is going to be to remove the skin from the face, and the easiest way to do that is to do a midline incision. We're going to go ahead and leave the skin around the eyes, leave the skin around the nose, and then leave just the lips, and then take that incision down. And then from both sides we'll just peel the skin back laterally, and we're not going to be keeping skin flaps here. We're going to remove the skin pieces entirely and put them in the tissue buckets. So that's essentially the first step, is just a thin skin removal, kind of like for the skin removal of the neck. So once that skin is removed, it will not look like this. If you do the job right, there's going to be a thick layer of fat that's covering everything, all the muscles and all these nerves and vessels that you see here. Our job for this lab is going to be slowly uncovering them bit by bit, not using a blade. So once you get the skin removal done, you really don't need to use blades anymore for the rest of the hour. The first section of the lab is going to focus on the lateral part of the face. We're going to be looking for the facial nerve and its branches. Probably one of the most important first landmarks that you find is the parotid gland. This is a tissue that looks very glandular. It's very obvious once you recognize it. It looks kind of like fat, but a bit browner, a bit more distinct in its edges than typical fat. So see if you can find where that parotid gland is in this region of the masseter and the ramus of the mandible. In this same area, you should be looking for the initial branches of the facial nerve, and I would suggest that you sort of start in this upper region. This would be probably where you're most likely going to find branches easily. If you go sort of just above the zygomatic arch and reverse scissors sort of in the expected direction of the nerve branches, it's pretty easy to find a temporal branch pretty quickly. And then below the zygomatic arch, probably easy to find a zygomatic branch. It's easier to start up here than down here. The branches down here are a little bit smaller. So once you find a couple of branches and you've pushed fat away from them using the reverse scissor, then you're going to want to sort of start working downwards and following these nerve branches back to the point where they join. And you need to be pushing the parotid gland away as you go. It won't come off in one piece like this. We'll be taking the whole gland out bit by bit. So you have all of the permission you need to cut and remove every piece of parotid gland, but you'll want to do that by sort of tunneling through the gland, following these nerve branches down into the tissue. The farther down you get, the more likely you'll be able to get to a point where you'll see other branches coming off. The next two, the buccal branch of the facial and the marginal mandibular branch of the facial, these you'll probably be able to find from this area as well. It's hit or miss whether or not you'll see the continuity of those thin branches all the way to their destinations on the facial muscles, but it does work every once in a while, so give it a look. In this area, since we've got zygomatic branch and buccal branch identified, you'll probably also find the parotid duct, which is a pretty thick duct that usually runs across the masseter about in this area between the zygomatic branch and the buccal branch. It's a helpful landmark to identify these nerves in space. Okay, the last branch of the facial nerve, you'll definitely not find all of it, but you might find a short piece of it that's heading down into the neck. This would be the cervical branch of the facial nerve, which would be responsible for the platysma, the stylohyoid, posterior digastric, those muscles that are down in the neck. So that's all 5 branches of the facial nerve. This will probably occupy about half of your time in the lab today. Demonstrating this is advanced dissection work. It'll use the best of your hand skills, so do bring them. for that part of the lab. After we're done with the facial nerve laterally, and we've found branches and we've found the sort of point of common convergence, then we're going to move to the anterior face, where we're going to look at muscles of facial expression and the sensory nerves of trigeminal. So I would suggest starting from the top because it's sort of easiest to most challenging. The frontalis muscle is on the forehead. It'll likely be very thin and it won't look much like muscle, but see if you can identify it. The orbicularis oculi will be pretty obvious. We won't have all the skin removed from the eye, so you won't see this much of it, but you'll probably see this outer portion of the orbicularis oculi muscle. Likewise, when we turn to the oral region, you'll find the orbicularis oris, and the zygomaticus major will probably be one of the first ones you see that'll be very easily identifiable. For the muscles of the mouth, there are muscles that attach more centrally to the lip, and these get the name labii. So this is an example of depressor labii inferioris, because it depresses the lower lip. So the name tells you what it does. On the other hand, there's muscles that attach more laterally at the angle or the modiolus of the mouth, and those are called anguli. So this muscle is called depressor anguli oris because it pulls the angle down. There are also these same muscles superiorly, and unfortunately you can't see both of them at the same time. Typically the levator labii superioris muscle is superior or superficial. This is the levator labii, so we're seeing an attachment more medially. You'll probably have to move some of that muscle out of the way in order to see the levator anguli, which is usually just a little bit deeper and has a more lateral attachment. In this sort of deeper space, you'll also find the buccinator, which forms the muscle of the cheek. I'm sure you know a thing or two about that already, but you will see that in that deeper space, and the fibers will be running more straight anterior-posterior. Okay, so we're going to turn next to some big branches of the trigeminal nerve, once we've got all these facial muscles figured out. For this, we're actually going to cut muscle away down to the skeleton. We're going to see where these nerves come out of the foramina that we talked about in lecture last week. So for this first set of nerves, for the V1 branches that we're going to find, you'll want to take frontalis and cut it through. You won't see all these nerve and artery branches here. These are branches going to skin. Since we removed the skin, they're gone. So we're going to look for where these came from and their origins. So to find that, we'll need to cut across the frontalis muscle and sort of peel it downward and peel it back. I can't really do that very well with this model, but this is what we're going to try and find. This point where the supraorbital nerve comes out through the supraorbital foramen, and the supratrochlear nerve comes out through the orbit more medially. So we'll try and find those two distalmost branches of V1. We'll do the same thing with V2. So you need to sort of figure out where do you think V2 is going to come out at the infraorbital foramen and the infraorbital nerve. So usually it's in about this area. If you have the supraorbital foramen, you can go straight down and it's going to be about in the same area. And you're going to want to push muscle away, peel muscle away to get down to the skeleton so you can find that point where the infraorbital nerve as well as blood vessels emerge from the infraorbital foramen. For V3, we're just going to try and find the mental nerve, and this comes out through the mental foramen of the mandible, and you will have to move some muscles out of the way to do this as well. An alternative way to find mental nerve is to actually cut through the muscle of the lip here and just peel the whole lower lip down. That's another way to do it. Either way, the result is the same. You see where the mental nerve emerges from its foramen. Okay, so that covers the facial nerve, the muscles of facial expression, the main sensory branches that we're going to find today, and then there's a couple odds and ends related to the vasculature that you should probably be able to find as well. Facial artery, facial vein, these have this angled course, from about midway back on the mandible up towards the angle of the eye. See how much of that course you can demonstrate for both the artery and the vein. typically the artery and the vein will sort of intermingle between these muscles of the mouth. So they might disappear for a bit and then reappear. In addition to the facial artery, facial vein, which supply the central face, there's also a couple of branches that supply the lateral face. This transverse facial artery, which is quite small and frankly not frequently found, running across the masseter. And then the superficial temporal artery, which is sort of the end of the road for the external carotid, which is responsible more for the side of the head than anything else. But you'll definitely be able to find superficial temporal, probably not transverse facial. So that's it in a nutshell for your facial dissection. The facial nerve is the tough part. The rest of it goes pretty quick. I look forward to seeing you in lab.